Let's go ahead and get started. Welcome, everyone. This is session one of our Workforce Professional Development series. So, if you've been with us before, we actually do these almost every project year. So, really excited to get everything going. We decided to start this first session, as you can see on the slide, all about compensation and how compensation supports retention. So, we're going to have a few housekeeping intro slides and then really just go ahead and jump in right to the presentation. All right. So I know all of us have been in this virtual world for a good amount of time, but always good just to have a reminder. But the session is being recorded, so the recording and the slides are provided to all registrants. This is not on the slide, but I also want to say, because you've registered for the Workforce Professional Development Series, you are already registered for the other sessions. We're going to do 3 sessions total throughout the professional development series. And everyone will receive the recording and the slides. You can also use the chat box to ask any questions, share any comments or thoughts. Now, in my experience, we've done a lot of these trainings. Compensation tends to get more questions and more dialogue. So truly feel free to just put whatever you need in the chat box, any comments, challenge me, we can have a dialogue. That's always a really wonderful thing if we get the chance to do that. If you are having technical difficulties, my colleague Mariah Blake is here, and that's who you would want to contact, and she'll be able to support you with any technical difficulties you may be facing. And then at the end of the session, we always have an evaluation. This is actually required of us through HRSA, so we would definitely appreciate if you could fill that out. But more importantly, it just helps us know, what are you looking for and how can we bring you the best training and technical assistance? Okay, so we're here today with ACU, so the Association of Clinicians for the Underserved. We were started by National Health Service Corps alumni almost 30 years ago. I think we're coming up on our 30th year anniversary, so it's always really exciting. But that's still very much of the foundation of what we do. But as you can see on this slide, it's really supporting those who work with underserved populations in the healthcare field. And we have a lot of different types of programming that we offer. Now, specifically today, the program that brings me here is the STAR Center. So that stands for Solutions, Training, and Assistance for Recruitment and Retention. What I like to point out in this slide is we are funded by the Bureau of Primary Health Care and the Health Resources and Services Administration. And we serve as one of 22 national training and technical assistant partners. And what that means is that we're funded to directly offer that TNTA to health centers. And our specific focus with ACU and the STAR Center program is all on workforce, especially when it comes to recruitment and retention. Now, all of the resources that are specifically through the STAR Center program, our training, our technical assistant, is all free for health centers. And we do have a separate website from our main ACU website, just so that we can house all of the different resources we have and you can easily access them for free. You can also contact us at info@chcworkforce.org. That does go to a real person, my colleague Sydney Axelrod. She's not on this call today, but if you need to reach out, and then she can filter it as appropriate to who may be on the team. And then this is the really wonderful, amazing STAR Center team. So I have the honor of serving as the Director of Workforce Development, really means the project director for the STAR Center. We have Mariah Blake, our Associate Director of Workforce and Operations. I had mentioned Sydney Axelrod, who's the Associate Director of Workforce Development, and then Suzanne Spear, who is our Vice President of Workforce Development. So you have our contact info here, so you could use the info@chcworkforce.org, or you can contact us directly. We're always here to help. Okay, so as I said, just doing some housekeeping slides, let's go ahead and jump right in. So we're talking compensation. One thing that I want to point out and not negate in any way as we go through these slides is really the understanding of right now, the different sort of financial struggles that health centers may be going through. I know there's a lot of change, things are shifting really, really quickly. So when we're looking at compensation, really the difficulty on how do you really strategize around that? How do you support it in order to retain individuals? So I don't want to negate that part. I really wanted to explain and understand. But as we go through the slides, this is really more of a high level, like what can you do? How can it support retention? What way can you really look at compensation that really goes beyond just the base salary? And, please take what works for you, leave what may not work for you, because it's also really dependent on what are the needs for your health center. And I see there is something in the chat. Oh, yes. Yep, Rebecca, all of the slides are going to be shared. So what will happen is once we finish the session, usually there's just a little bit of a wait time, especially right now, just as we kind of get things approved and stuff like that. And then we'll be sending out all of the materials to everyone. And this will be the same thing for the other sessions we do, or really any webinars that you attend with the STAR Center, which probably just a few exceptions, but for the most part, everything gets shared out. So, as I said, I really wanted to start with acknowledging the difficulty, acknowledging the struggle and the real challenges that health centers are currently facing. But compensation is still a critical thing when it comes to recruiting and retaining anybody who works in your health center, not just providers. So these beginning slides really just building the foundation from that. It's just how do we think about this? So this slide, if you've attended any of our trainings, you probably have seen it. And the goal and the thought process is that if you don't have a workforce, you don't have a health center. So it is really critically important to really think about how are we investing in the workforce? How are we looking at operational and staffing resources? And a huge, huge component of that is compensation. Now, in a moment, I'll get into what does that really mean beyond salary and how can you really place yourself in the best position possible to attract those right candidates. So one of the things when you're investing in the workforce, there really are some key features when we think about high functioning health centers. So here you'll see 8 core components. Now for today, we really are going to be looking at this second one from the left on the on the top row, or from my left, on effective compensation structures. And while I will say salary every once in a while, I really am intentionally saying compensation because it really goes beyond the base salary. And it's really critically important of like, how are you talking to your staff about this? How are they really understanding the total compensation package that they're receiving? Now, when we look at the rest of the core components, they don't exist in a silo. All of these really impact each other. So if we look at the tested recruitment and retention strategies, ensuring, fair compensation is a critical part of that. Policies and procedures that support the health center missions and values, compensation is a huge part of that. It's really important to also understand that, fair wages, living wages, really are an aspect of ensuring that you're doing that mission-driven work and living those values of the health center program. Now, the other thing that I want to point out before we really dive into the compensation piece is that all of this that you're doing, you're building strategies, you're building ideas, programs, put it in a comprehensive workforce plan. So at the STAR Center, we actually have a comprehensive workforce plan template. We're currently working on updating it and we're hoping to release it fairly soon. Our goal is potentially before the end of the year, but we just wanted to make sure to overhaul everything and just give you the latest information. But it serves as a template that any health center can use, and it is HRSA approved to build out your comprehensive workforce plan. And when we're looking at retention strategies, recruitment strategies, development strategies, even assessment, all of that, compensation is an aspect of this. So for example, assessing, there's going to be a slide later on, like how do you do a pay audit? How do you look at ensuring what, are the market rates? Where are we in paying individuals? And then of course, retention is a really critically important part compensation is a really critically important part of ensuring that you're retaining people. Recruitment as well, we're going to go through, adding salary ranges to your job announcements, which I know everyone feels a little bit different about that. So again, put it in the chat, like I'm happy to always go through any comments. Development strategy, when you're building career pathways, that is an investment that you're making in the workforce. So how can you really quantify so people see what you're really providing them and what that total compensation is for them? So I really want us, as we go through the presentation, to think in that lens and to realize, okay, as we're working on this as a health center, as we're working on building this, it's really important that we're putting everything into a comprehensive workforce plan. Also, I know that this has been requested in some OSV visits, so I highly recommend that you just get going on it anyways, so that you have it ready to go and it's something you can utilize, especially now when we're seeing such high rates of turnover and burnout and things of that nature. So just kind of honing in on that retention planning, the retention planning piece. So this is part of our comprehensive workforce template. We have what we call our recruitment ladder. We have key areas of retention, and this is where the compensation and benefits really sit. Because again, it's such an important tool to ensure that you're retaining people, bringing someone through the door, ensuring that you're providing, a living wage is just really the first step of then how are you doing promotions, if you do bonuses, all of those things. So again, thinking broadly, benefits, this is one of the things that when we look at health centers, and our team travels across the country, US territories, I feel like health centers really shine when it comes to benefits. So really, really important to have that as one of those aspects of compensation. So I also wanted to put a few questions. Now, you don't have to answer this in the chat. If you would like to, you can. This was more for you all to kind of think about what are your most pressing challenges to workforce retention. So if anybody would like to comment on the chat, add what their challenges are, please go ahead and do that. That would definitely be great. But also don't feel, oh, and I see somebody has their hand raised. Mariah, I'm so sorry. Are we able to unmute for someone with their hand raised?
Yep, they can request to unmute, I believe. They're just
Okay,
back directly to me and I can help you out.
perfect. Oh, and I don't see the hand raise anymore. So yes, if anybody wants to unmute, just do the little hand raise symbol and we'll make sure to unmute you. But what I wanted you to think about with this question is there's a lot of challenges you're facing. I have no doubt, and that's why I wanted to start off the presentation with really acknowledging that. What does that mean for you? But it's really important that you go through and you look at what are these pressing challenges as sort of a larger scope of your comprehensive workforce planning. But I am going to say probably 9 out of 10 health centers, and I know that's just I kind of am just kind of guessing that, but that compensation is one of them. Now, being aware when you're looking at the competition of hospitals, private networks, private doctor, dental, or mental health, offices, vision offices, whatever it may be, it is difficult to really compete with those base salaries. So what can you do? And this is why you really need to think about what are our challenges, because you then need to prioritize what are the main things that we're going to look at first to ensure that we're supporting our workforce, we're supporting recruitment, we're supporting retention. And I really would highly recommend that as you go through these challenges, that one of the high level ones that you really should think about and ensure that you're investing in is compensation, because this can be a really quick way for someone, unfortunately, to leave the organization. And we really want to keep these mission-driven individuals. Oh, it's not. There we go. So what does this mean? How do you approach this? So as you can see here, it says competitive, effective, and sustainable. If we think about competitive and sustainable, those two sometimes can really clash, especially right now when I know, health centers are really looking through their budgets and how do they really fit into the compensation they're providing. But again, as competitive as you are able to be is critically important, because again, you do want to get through the door. Like the people who are going to work at health centers most likely are mission driven. And I'm sure that they know, okay, the compensation may not really be exactly what I'd be able to get in a hospital or a private practice, but I want to work with this population, but also ensure that I can live off the compensation that I am receiving. So in order to really look at that competitive piece, it's really important that you're analyzing what are your current salaries, how do they compete with the local market, how do they compete even with these other organizations where the salaries may be higher. But the reason that you want to do this is so then you can look at like, okay, where are these gaps and what can we really fill into that? So it may not be a salary increase, but could we offer and support professional development? Again, there's a cost that we're putting, that we're investing in people. And one thing that is really, really important when we think about this, when we think about the compensation structure, is that you're really communicating to your staff what you're providing them and how you're investing in them. It's really important for people to just understand, how can I build my career here and how is the organization investing in me? And I will say, regardless of the position, because I know a lot of times we focus more on the providers and the clinicians, but this really should be across the organization where you're really auditing the salaries and trying to better understand where does everybody fall and where can we modify if we need to do that. But part of the reason you're also doing that analysis is to ensure sustainability. That is really critical. You also don't want to put yourself in a position where you cannot be sustainable and you may need to cut your workforce or change salaries around. So, you want to play a very careful balance with this. So the more that you can analyze, collect data, really look across the spectrum of what you're doing, the better positioned you will be. I do also, and I didn't put it on the slide, but hey, I should have. We have at the STAR Center what are called data profile dashboards. So every single CEO or executive director of a health center every year receives access to these data profile dashboards. And basically what they are is that we take data from UDS and other metrics and we analyze it and we put it in a dashboard where you can easily look at where do you stand as a health center in different metrics for recruitment and retention. One of those metrics is where do you fall within your state or nationally with compensation. So we had one time, I remember a health center, we were doing TA with them, we were going through their dashboard and they realized for the first time they were on the 90th percentile of their compensation. So they were actually, paying people really well in comparison to what they were seeing with the rest of the state, but they actually didn't even realize it. And I was like, yeah, you can use this messaging as a way to recruit people and retain people. So it's critically important, but it does take a lot of forethought, a lot of planning, and a lot of thought through data to ensure that balance between competitive, sustainable, and effective. Also, as you do this, it shouldn't be done in a silo. A lot of people should be involved in this. So, obviously you're looking at the CEO, CFO, potentially COO, different individuals in the C-suite, those in human resources. If there's other people doing workforce focused work in the health center, and even the direct supervisors that should be having conversations with their staff about salaries, because people will ask and they will share with each other as well. One other thing I want to point out, and why this is so critically important to so many people, especially the people who are coming into the workforce now. As it says here, the salaries itself only really grew just under 18%. And this is up to 2020. And as we're looking into 2025, there's still a strong stagnation when we're looking at salary and wages. However, the productivity that people are putting out grew substantially more. So here we're looking at almost 62%. So essentially what this is saying is people are working a lot more, they're working harder, but the salaries aren't really keeping up with that. So again, with the acknowledgement that yes, you may not be able to compete with salaries of some of your competitors, but how can you really fill in those gaps so that people feel like all of the productivity that they're putting forth, that they're still receiving a salary that reflects the work that they're doing? And I see there's something else in the chat. Oh, yes, Monica. So, yes, so the way that you get access to the data profile dashboards, and usually we send out access to it in May or June. So we had just sent it out in May and June of 2025. There is an email that goes directly to each health center CEO or executive director. Now, we're not allowed to send it to anybody else, and that's part of our data use agreement. So once the executive director or the CEO receives that email, they will be able to log on and they're going to create a password. What happens is once they do that, they can then share it with anyone in the health center. So a lot of CEOs will share it with their HR directors and other people who are doing workforce information. Now, if you go back or you find or you are the CEO that you haven't received this, Mariah Blake, oh, she beat me to it. I was going to say Mariah Blake will be your go-to person, but it is available to every single health center. And I would check with your CEO or your executive director if they did receive it. So it's usually sent in like late May, early June, like May, June of each year. So we just sent out the emails May, and I think a little bit in early June of 2025. We also sent out a mailer, and that went to every health center again, to the CEO or the executive director, just letting them know like, hey, this is how you get access to this. But yeah, if you want any more information, if you find that you don't have access to it, then just email Mariah Blake and she will be able to help you. Just with the caveat though, that we cannot give access to anybody who's not the CEO or the executive director, but they can give access to anybody in their staff. So, and please ask any more questions regarding the data profile dashboards. I also do want to say in this, we've had this a few times where either the PCA or the health center have requested a little bit more focused TA when it comes to the data profile dashboards, like how do you use it? What are we seeing with these numbers? So when you have access, if that's something you're interested in, you can contact us and we can meet for like 30 minutes with the health center or do kind of a more in-depth training with PCAs if that's something that they're interested in. Okay, and I think, yep, there's one more. Oh, perfect. Thank you, Mariah. Yes, so this year we send it out a little bit later in June. Yep. And every year it really will be between May and June. So as we get to the end of this project year, which is June 30th, 2026, we'll be releasing the newest data profile dashboards as well. Okay, so as I mentioned, I talked about total compensation. And I think this is really, really important, especially for health centers, because we hear a lot of people saying, people just beyond the base salary, they're not really understanding or thinking about everything else we provide. And I think part of it, there's a few things going on here. One, a base salary that ensures that, people have a living wage is critically important. So that's at the baseline of starting there. But a lot of people don't always think about what do the benefits mean? What does it mean to have professional development, career pathways? Because again, as health centers, you're making a really big investment in your workforce as you're doing this. But these aren't really conversations that people have very often or even knowledge that they're given. I know, throughout all my education, like nobody really taught me to think about retirement. It taught me to think about like, what does it really mean to get a fully comprehensive, medical insurance plan? What does all of this really mean? So it's really important when you're recruiting someone that you have these conversations with them. It's like, as a health center, here would be your base salary for the position, but here's everything else we offer. And I highly would recommend, if possible, to actually quantify it. Quantify what is the investment on the individual with benefits, because I'm sure it is a big investment that you're making. Quantify if you have professional development opportunities. So let's say every year you have, 1,000 or what, I'm just thinking off the top of my head, for providers to go get CEUs. Quantify that and really let the candidates know. There's some health centers that have really amazing career pathways. Some are more structured than others, but again, quantify what this really means so people can see, okay, this is what I'm receiving as my base salary, but here's everything else I'm getting. And this is how I'm being supported in the workplace, because I feel like that is the key that so many health centers, that's where you thrive. Also, once you have candidates and obviously your workforce, when we're looking at this from the retention lens, I would highly recommend to have individuals from HR just send regular emails to inform people of what are the benefits that we have, what do we offer, what can you use, again, professional development, career pathways, because people don't always know what they actually have available or how to use it or what it is. And I've been in jobs before where I needed something and then I found out that was actually a benefit that I could have been using, and I just had no idea. I had no idea that that had been offered. So again, this is what we think about when we talk about total compensation package. Another one that I do want to point out is workforce well-being. So there's, health centers that offer people gym memberships. There's some rural health centers that we work with. What they do is they offer their staff like cards for Amazon so they can purchase things since they're really far out, so that it's easy for them to get some of the things they need. I mean, anything that's really supporting your workforce, it's really important. And again, if you're able to quantify it and show people like this is the investment that we're making for you. I also highly recommend, and I think this goes in line very strongly with when we're looking at mission-driven organizations. So I have presented this slide in the past, and I've asked people, do you know what a compensation philosophy is? And I get more no's than yes, or people are like, I think maybe, but essentially it really is just a written statement that everybody in the organization would be able to see and have access to, the same way that you have your mission, right at the, usually on your website or right on the first page of your website, that it's really going to guide the organization And what are your values when we're looking at compensation and the practices associated with compensation? And it really it should be simple. It shouldn't be, anything too complex. Kind of, again, similar to a mission statement, fairly simple and straightforward, but you want to highlight what is your commitment to the workforce. So, you could say things like ensuring transparency when we do pay audits, whatever works for you. But the reason that this is really important is because, again, it gives your staff an idea of how are you approaching this. I think for a very long time, and in many ways, this is still the case. Compensation or conversations about compensation were a little bit taboo in the workplace. But that has really shifted. That is very much not the case anymore. And even if people are concerned about those conversations, people will share it. People will still share what they're making to ensure and better understand where do they fall in the different salary ranges for their positions. I share this story a lot. My whole career has been in nonprofits. And one of the things, especially with the newer people coming into the workforce, that they do, even while they're interviewing, is we're nonprofits, so your tax returns are public. They look there to see what are the highest compensated people? How does that then reflect what my compensation is for the work that I do? So all of this information is already being shared, so you really want to ensure that you're showing your workforce, yes, we have a commitment to when it comes to this, and we understand the critical importance that salaries make. I mean, that means the housing you can afford, food, especially if you have children, daycare, things like that. Student loan debt, that is a huge one that I think really propelled so much of this focus in compensation and why it's so critically important. So again, see what works for your organization, but really would highly recommend a compensation philosophy. And if you do have that, put it, for example, in your job announcement, stuff like that. So again, people can see, wow, this is a mission-driven organization that really understands the critical importance around what compensation means. As I mentioned as well, benefits. This is where, again, time and time again, I see health centers excel so much with benefits. And I think what it is you all really do think comprehensive, flexible, and creative. And I think the creative part more than anything, because, when you have to work with limited resources, you need to get creative, you need to get innovative, you need to understand, where is the most effective place for us to put our money. And benefits is a great, great option. So when we're looking at benefits, I go back to that analyzing and collecting data. Health centers have amazing benefits, but either people may not know about some of them, or some may just really not be utilized in the way that you would think they would be utilized. So you're spending and really putting a lot of investment into something where maybe you could shift it. You can move it somewhere else to really meet that need of the workforce. So one of the things that I always recommend, and my background, I have a lot of background in human-centered design. And, it's a little bit more complex than just kind of what I'm about to say. But at the essence, it's starting with the people. Talk to your staff. Talk to your staff about what are the benefits they're using, what are the benefits they need, and you can make modifications based on that. So there was a health center that we spoke to, or I think I was at a conference and I was talking just kind of informally, but I was talking to them and we talked about benefits. And one of the things they did, they realized there was some benefit that they were providing that people just weren't using, but a lot of money was being placed towards that. So they went back to their staff. They literally assessed them, did a survey of like, well, if we were to relocate this money, what would be something that you would want to put it towards? And they got really creative, and essentially they came up with two things where the staff could decide which one worked best for them. One of them was paying the interest on student loan payments, paying a certain amount for people each month, which for a lot of individuals who have student loan debt, I know that I'm one of them. That is something that's so critically important. But again, they took something where they were investing a lot of money that wasn't really being utilized and reinvested it into what the staff was directly saying that they needed. The other option was adding more into people's retirement. So people really got to select and decide what works best for them, what are their needs are. And then for the health center itself, when you're looking at budgeting and things like that, they weren't left spending a lot of money on something that just wasn't utilized. But you really want to think through, how can we have very comprehensive benefits that support our workforce? I also would highly recommend, and I think this is part of when we're talking about mission, we're talking about the compensation philosophy, that the benefits you provide really impact everybody across the organization, and that you're able to provide all of the benefits to as many people as possible. Because one of the things when we look at compensation, when we look at benefits, when we look at total compensation package, we've had and we've heard people who may work in the front desk or MAs or DAs, other people who are really in that in those positions that are like, some of the benefits are more for the doctors, for the providers. So you don't want to create such a divide either. Now, I understand the critical importance of ensuring you're retaining these clinicians, but again, everybody plays a really critical role, and it's really, really important that you're showcasing that to your staff. I had a story one time with, again, a health center. And one of the things that they did was they did lunch for the providers. Again, that's an investment you're making. There's a cost associated with that. And I'm not really sure why they chose to do this, but they shifted it that the lunch was only available to the medical providers and no more the mental health and dental providers. What happened, that created a really big divide. So again, knowing people talk to each other, they share this information, really, really important that you're communicating with your staff and being able to offer as much as you can across the board. And again, it's what you can do. So this is not a steadfast rule by any means, but it's just something to think about, because time and time again, turnover is going to most likely cost you a lot more than it is investing in benefits, salary, things like that. So how do you talk to staff? It's really important that you talk to your staff about compensation. And this should start right from the onboarding process, and actually even before, while you're interviewing someone. You really want to make sure that what the person is thinking for their salary is really aligned with what you're able to offer, because you don't want to go through an entire recruitment process. Again, the money, the time, the investment you make on that, you get to the final piece and it just doesn't work out because those two things weren't aligned, which is totally fine. Everybody has different needs, but you just want to make sure you're really getting ahead of that. Now, for those who are already working in the organization, being able to talk to them about the policies and procedures. So, what does it mean to be able to get bonuses? How are people getting raises? Is there a metric that is being used, or is there a larger compensation philosophy that really guides the policies and procedures? Salary ranges. Now, this does vary state by state. Some states require it, others don't. More and more states are moving towards requiring salary ranges. So I highly recommend that even if you don't post it in your job announcements, that you have salary ranges that your staff can have access to and really understand where those metrics on why they fall where they do. This also helps you be very objective in having these conversations. Because one of the things you don't want to do when you're talking to staff about compensation is be subjective about it. You really want to come forth and say, okay, the reason that you fall in the salary range is because this is your tenure, education, different special uh, like credentialing you may have, all of those things. So you want to really have it as objective as possible, and it should be written down. It should be in your comprehensive workforce plan, understanding the factors for bonuses and raises. And I put on here, they really should be available to all staff. Again, understanding one of, I think, the critical things, especially now when we're looking at some of the challenges that health centers are facing, is really understanding what are the most critical staff that we need. What is that immediate need that we have right now to keep our doors open, to be able to provide the services to our patients and to our community, and really focus in on those positions. But once you have done that, how are you then spreading the bonuses? What are you looking at? Who would qualify, who may not qualify? But really thinking through, as a retention piece, the more that you can have this across all staff, the better positioned you will be. Because if you think about the person working in the front desk, that's the first person that any patient sees when they come into the health center. The MA or the DA, they're the first people there with the patient in the room. So everybody plays a really, really critical role, but you really have to assess, like, what are the roles that are most important for us right now, and focus in on how you can support that retention. As I said, benefits, show the value, like actually quantify it and communicate that to people. Now, this one's hard because it's never easy to hear concerns or critiques or feedback. Staff, especially when we're looking at the immediate supervisors should really be trained on how to talk to their staff on compensation. And they should have a really strong understanding of the policies and procedures that take place in the organization. So then when their staff members ask them questions, they're able to respond. But at times this may come with concerns or critiques or any other type of feedback, or you're doing something more formalized, like a staff satisfaction survey, things like that. It's really important to try to better understand where those coming from. Now, this doesn't mean that everything that everyone asks for is going to happen. And part of like a transparency around this is saying, at this time, that's not something that's doable, but we will consider this, we will look at it. And I think if you come from that genuine perspective, people tend to be more receptive of that. And again, just highlighting that people really are making that living wage. Honestly, I would argue a thriving wage, but you're doing that mission-driven work. So connecting people back to why are they here in the health center, and compensation is a critical part of that. Those things are not separated from each other. So, and really try to brainstorm, be flexible and adaptable with benefits and career paths. So again, I wanted to put this in here more for you to think about this. So how do you talk to staff about compensation and salary, or do you talk to them? And what I really want you to get out of this question is, do you have a strategy for that? Are you training your direct supervisors to understand those policies and procedures, to really speak about this in a very objective manner? Because there's also, legality around this, and you don't want to put yourself in a position that is not helpful for you. So thinking about and strategizing how you actually talk to people about this, and who are the individuals that are having those conversations, is critically important, because at the end of the day, it really starts with a conversation to better understand where people are and what do they need. And I know that seems very simplistic, but you'd be surprised how much data you can really collect from that qualitative data. So Other places where compensation and talking about compensation is really critically important is when you're doing job announcements and when you're doing interviews. So one of the things is including salary ranges in job postings. Again, this is already required in some states, and more states are moving towards that. So, and if you kind of get the sense that that's what's happening in your state, I would highly recommend you just get ahead of that, because that transition and then, coming up with the metrics for the salary ranges can be very time consuming. Now, for those where it's not a requirement, still highly recommended for a few reasons. And I know that there is a hesitancy sometimes, because it's like, if I put the salary range, I don't really have the ability to negotiate, or people may just overlook it because it's not in the scope of what they were hoping to get. Now, what I say to that is that's fine, because if it's not within the scope of what they're looking for, you will get to the end of the entire recruitment process, and most likely the person would not accept the job, because there is such a discrepancy between what the health center is able to offer and what the individual was looking for. Another thing with salary ranges, and as we're looking at the new generation of the workforce coming in, where this is such a critically important aspect of their well-being and everything, is that many will not even consider a job unless there is a salary range. So you may have an excellent candidate that is interested and is okay, the salary range fits what they're looking for, but they just didn't take the time to apply because that was not posted. Now, if that's something for your health center that doesn't work, that is perfectly fine. But I would highly recommend from the first interview, so the phone screening you do, or whatever it may be, that you are talking about compensation. Tell them this is the expected pay rate for what we're doing. This is where you can bring in that quantifying of benefits for them. And again, make sure that it just aligns. And if you have a compensation philosophy, go ahead and talk about that as well, and benefits. Onboarding, now you've taken that next step. You've already had these conversations, put it in your salary ranges, internally in the organization. Your supervisors are prepared to have these conversations. And why is it also really important for the supervisors to know how to talk about this is because from the get-go in onboarding, you should be talking to your staff about this. That's something with anybody that I've onboarded that I really prioritize, because I know how important it is for people. So here's where you really want to educate staff on how can they really maximize their benefits. What is the total compensation, packages, the openness on talking about salary, understanding the salary ranges. If you have career pathways and professional development, what does that mean? How much are you offering? And then if people are able to go through these pathways, move on to the next step and be promoted, is there a salary raise? What are bonuses? So just having this conversation is critically important as part of the onboarding process, because we know onboarding can really make or break a candidate. And again, you just don't want to invest all this time and money and everything to then have somebody leave. So getting ahead of it is really, really important. Also, and I had put in that total compensation piece where we were looking at well-being, financial wellness is critical. This is, again, how we pay our rent or our mortgage, taking care of kids, paying student loans, paying your car, transportation, food, all of these, critical necessities that we have. If we are not in a financially secure place, or in a place that can really cover that, your well-being will really be impacted. And, there's a lot of aspects of mental health that come into this when we look at the stress of finances, but that's for another time to go deeper into that. But I think there's a lot as health centers that you can do to really position your people in the best place possible to be able to support their financial wellness. So one of the easiest, I actually kind of think, is providing financial literacy classes. This is, again, something that we're not really taught. I still will never forget, in high school, I took AP calculus, and my teacher one day was like, all right, we're not doing any calculus today. We're going to learn how to write a check, how to open a bank account, because nobody else is going to teach you this. And she also taught us like how to manage some of that money. So this is really bringing in speakers or people who focus on this, on letting people know those financial literacy and what does that mean and how can they really maximize not just their salary, but their benefits and everything else that's being provided. So that's where you're hosting speakers, training opportunities. Part of the financial literacy is also trying to offer some solutions to support the employee's financial stress, because I think regardless of who you are, one time or another, this has, or for most people, this has been something that they're facing. And I go back especially to the student loan debt. It is incredibly high in the healthcare field because of the cost of going to school for the different positions that people are in. So how can you really manage that, and being able to educate your staff on that effective management through different speakers and training opportunities can be really, really effective. Also talking about retirement planning and long-term financial goals. Again, a lot of people, because this is not something you think about, especially when you're younger. I mean, I don't want to generalize solely with that, but it's just you're kind of moving forward and the future seems pretty far away, but it gets there pretty quickly. Again, usually these are not things that we're taught or talked about. So as an organization, being able to offer people these benefits can be very, very effective. And then finally, a thriving wage. Why did I put thriving? So we have a living wage, and that's critical. But when we're looking at a living wage, we're looking at just the baseline, our housing, our food, ensuring that we have just our medical care, whatever it may be. But a thriving wage, what it allows people to do is to go beyond that. This is when you're looking, if there is a medical emergency, do I have money that I'm able to save to approach that? If my car broke down, do I have some savings that I can do? If my student loan, those interest rates especially go up and down, do I have the ability to then take on that difference? So it's a broader concept, but I really would try to aim for not only basic necessities being met, but the ability for people to really save money and have a place where they can really maximize what their salaries are and their overall compensation. I did say that I wanted to mention a pay and compensation audit. Now, I put this slide in here specifically for you all to have. And this is just a step-by-step process of like when we're doing a compensation audit, what are the different steps that we need to take? I didn't want to go too in-depth into this, but it's more of just a reminder of when you're looking at compensation, when you're trying to decide what are the compensation structures, what are the salary ranges, what is everything that we're offering, you really need to start with doing that analysis, because we don't know what we have to fix until we're able to analyze what is going on. So this is just a very high level step-by-step guide that will really help you go through as you're doing these audits. I also would highly recommend, as you do pay or compensation audits, however you would want to call it, that you are bringing in people who are experts in data analysis and people who understand the legal context of paying compensation, especially if you're in states where these things have shifted, there's new laws that have come through. Very important that you're in line with everything that you need. So you really want, even if it's for a temporary consultant, and I know there obviously is a cost involved with that, but ensuring that you have the right information, because what will happen is when you start seeing, where are the gaps, then what are the practices that we may then need to implement? What are the changes that we need to make? How are then we communicating this to staff? Are we, telling them the outcomes of what we're finding? So there's a lot that goes into this that really will help you not just build that comprehensive workforce plan for the compensation piece, but overall see where you fall on this. And just going back to the data profile dashboards, that's something that can also help with this. So yes, please reach out to us if your CEO or executive director has not gotten access. I think it goes back to what I was saying. It's just important for leadership to really reflect those values, and ensuring that people have a living wage or a thriving wage is a critically important part of any mission-driven organization. You do amazing work with your patients and your community. You want to ensure that the words that you're putting forth in that mission is also being reflected internally into the support that you're providing your workforce. And then finally, turnover is expensive. So, I said a lot of things, but if you just look at what it costs, turnover time and time again will be more costly than it is to invest in these other aspects. Again, not just salaries, but the total compensation package. Now, this is hyperlinked on this slide, but we have a financial assessment provider turnover tool. It's an Excel spreadsheet that you can download, and basically you put in what is the entire cost of losing a provider. Now, for this one, we're only looking at like people who are MDs, DOs, nurse practitioners, PAs. So it is really focused on the provider scope, but it gives you an idea of bringing data back to your C-suite and saying, look, every time we lose an NP, this is how much we're losing versus this is the investment we would need in hopes of keeping them. So this is a great tool that you can use, and it is hyperlinked on here. But if you have any issues accessing it, just let us know and we can send it to you. And it's also on our chcworkforce.org website. But the best way to really approach this when you're going to leadership is bringing that data, bringing those numbers and showing them, what does it mean to invest versus what does it mean to lose people, and what is the cost for both. And then that is the presentation. I know we have just 3 minutes. I was hoping to leave a little bit of time for questions. So does anybody have any questions, any comments? I'm here to answer anything. I'm not seeing anything. Okay, so it seems like no questions or comments. If you have any, just put them in the chat and can definitely address. Oh, I do see. Oh yeah, so Susan, right now the turnover tool is just for the MDs, DOs, NPs, and PAs. But you can't take, so we also have put a lot of data there of just like general estimates of what different costs are. And we look very broadly. So for example, we're looking at if you lose someone, what is the cost that it takes to then have the HR individuals put in all this work to recruit someone. So you can take a lot of those data points and use it towards other positions, the sort of more general metrics. And if you don't have the numbers, I should have mentioned this as well. If you don't have the numbers, we provide estimates for you based on different data analysis. And then as we come up on time, I don't see any other questions. Mariah is going to pop up the evaluation. Again, we would greatly, greatly appreciate if you could fill it out. If you want to sign up for our newsletter, please go ahead and do that. Everybody is going to receive these slides and the recording as soon as we have everything ready to go. And then oh yes, nice to hear that the entire compensation package should be shared with health center staff As at my agency, the philosophy has been not to share. Yes. And, that isn't a lot of organizations, Stacy, but the reason that I argue the importance of that is because people are going to share it anyways. So it's just better to show, yeah, we have a certain level of transparency, which is goes into staff well-being, supports things like burnout, all of that. So the more that you can communicate, the better it is for your retention and your recruitment. Because at the end of the day, people will still share this information. But I know we're at time, so I just want to say thank you to everyone. You all were an excellent, excellent audience. And here's again our contact info. And I hope everyone has a really wonderful day. And hopefully you'll be able to join us for the next 2 sessions of the Workforce Professional Development Series.